Hi, everybody. My name is Natalie Yeadon. I'm the CEO and co-founder with Impetus Digital. At Impetus Digital, we have built some of the best in class asynchronous and synchronous virtual collaboration and communication tools. We have worked with life science companies from across the globe over the past 13 years. We've helped them with everything from virtual advisory boards to virtual medical education programs, publications, steering committees, investigator groups, and all sorts of other things. And since the launch of our award-winning Insight Events platform, we've been helping these life science companies with their large corporate events, sales training, hackathons, and everything in between. But more importantly, at Impetus, we really believe that everything starts with a conversation. And from these big, hairy, audacious conversations that we have with some of the leading edge thinkers, the digital provocateurs, the healthcare thought leaders, that we can all work to collectively and positively disrupt healthcare. But we can't just end it there. We need to sustain these conversations. Is precisely the reason why we've developed the Impetus Insight platform. So we can have a series of ongoing touch points virtually, both synchronously and asynchronously over time, so that we can move agendas forward, policies, legislation, ideas, and that way we can really move ideas forward. I'm super thrilled to having one of these really leading edge thinkers with me at the table today. This is Sara Aghvami. She's actually the director of Best Buy Health at Best Buy Canada. Who would have thought Best Buy in health? This is what we're going to be exploring today. Sara Aghvami leads a team committed to enriching older adults' lives through technology. And in her role, Sara has developed strategies and business models through partnerships with healthcare providers, senior living organizations, clinicians, and researchers to drive positive benefits for consumers, businesses, and communities at large. Sara lives in Port Moody, BC, and she has more than 20 years experience in retail leadership. She's an expert in technology commercialization, omni-channel logistics, service offerings, customer experience, and humanizing processes to gain customers basically for life. And during her time at Best Buy, Sara has led numerous service offerings, including establishing secondary retail markets, radically improving customer experiences, and delivering significant service transformations. Sara believes that staying human and staying relevant in any industry is really what drives business success, as well as community trust. And boy, do we need more of that today. And she's motivated by creating meaningful change. Super happy to have you, Sara, on the show. Thank you so much for being here.
Thank you so much, Natalie. A pleasure.
So what an interesting, this I will have to be honest with you, Sara, it's a little off from what we normally do with people that are heavily entrenched in pharmaceutical and biotech and, these sorts of things. This is really interesting for us that a company like Best Buy is getting involved in healthcare. But more importantly, an individual like yourself with an interesting trajectory that you've had around retail services. I'd love to find out a little bit about your voyage in your career and how you landed in this place at Best Buy. And then we're going to explore a little bit about how Best Buy got into healthcare in the first place. So tell us a little bit about yourself.
Oh, for sure. I mean, I had very humble beginnings with the organization. Believe it or not, I actually started as a customer service rep, which was a job to help me pay back some of the student loan. My career aspiration was to become a diplomat and work in some consulate somewhere. It turns out I hate politics, and a future shop at the time was actually the great learning ground for me. So I pretty much started there, and I grew up with the organization, very proud member of it, and continue to be. So that is really how it started. And really, for me, it's always been looking for areas of opportunities and come up with a good cause and trying to be meaningful in every aspect, create a business out of it, replace any inefficiencies with it, and then kind of move on to the next project. And we can talk a little bit about health, of course, on this very topic. Yeah.
So it's really interesting, Sara. So you have, it's sort of rare these days that people grow up in a company. And you actually brought up a name that we haven't heard in a long time, which is Future Shop.
Yeah.
For those of us who are Canadians, know that that's no longer a thing. It was bought by Best Buy, and so you've kind of grown through this organization. So I'm just curious about what that was like, getting through that, starting into a leadership role, and what your thoughts are on creating a personal brand within a large corporate organization like Best Buy.
For sure. I mean, through the past couple of decades, I would say, other than obviously working hard and doing all the right things, which is, of course, everybody's expected to show up with, we have an incredible series of leaders who have taken Future Shop and therefore Best Buy through some major choppy waters, as you can imagine. So through the years, organization's been through a lot. We went through leaders after leaders, different ways of navigating the sea, of course, after another. But one thing I can tell you is the company always stayed true to the values, to its values and to its employees. And this is why it's just so hard and unimaginable for somebody like me to even, part ways. You cannot look away from an organization who's working hard to continue to stay relevant and then still embrace, gracefully throughout the years. So I would say this is exactly why I've stuck around and will continue to be part of the organization. The change was, of course, radical, and will continue to be as everything's kind of, shifting from being to fully digital, of course, in our world. And then obviously pandemic has impacted everyone. But again, it's how you brace yourself as a crew on the ship and make sure like choppy waters are surfed at all times. So the changes have made us who we are, veterans of Best Buy and Future Shop. And of course, if we're not accustomed to change, I don't know how else to live this life, to be honest.
100%. So well said, Sarah. I love it. So we're obviously going to be spending a great deal of our time talking about your pivot into healthcare, but I want to actually explore this a little bit further because I think the organization in general has some really interesting, probably pearls of wisdom and some nuggets that many other organizations could probably learn from. And that is about how to handle potential disruption. So if we actually backtrack a little bit and we start thinking about the advent of e-commerce,
Mhm,
we start to think about some of the giants like an Amazon, where it's really easy to point and click and order your electronics, or, Amazon comes to mind. I'm sure there's many others.
mhm,
And so you're now competing on this online space, and Best Buy has always positioned itself as this epic retail, real estate entity that's in your local community. Tell us a little bit about what that was like of sort of shifting the mindset
mhm.
away from the retail, physical space into a competing feat, or to like a competing incumbent against an Amazon in the last several years.
For sure. I mean, I would still call Amazon actually, we're no by no means, I would say competition is healthy to be, in the market with big muscles. It pushes our borders. In fact, Amazon as our partners on some fronts, which is the best healthy Canadian way of doing business, I would say. Um, I think as you said it too, Natalie, I think our secret sauce, which is not so much of a secret, is keeping that community sense in our footprint at all times. So stores continue to get better and better. By no means we digitize that experience in the store. You still welcomed, you still feel embraced, you feel like this is a destination, you still come in, ask for expert advice. And one thing we do offer and we spend tons of money on, of course, is our incredible Geek Squad services. So service add is one thing that differentiates us in the market. It's easy to sometimes for some people to take things off the shelf and go home and feel great about the setup. I mean, a good percentage of those go sideways. And we're there to, have their back, which is again, like what I believe has had given us that competitive edge in the market is having the customers back after the purchase, post purchase. So Geek Squad has been our second secret sauce in a lot of ways, and that is how we continue to compete in a human way.
Yeah, I think it's brilliant. And it's so interesting in a world that's heavily vested in SaaS or software as a service and everything else that's kind of just licensed. There's really something to be said about adding that extra human element that I think we're now starting to resurface as being, as you've said it, a secret sauce. So really eloquently said. So moving from that, for your first obstacle is overcoming the shadow of e-commerce, specifically through the Amazons of the world. The second thing that hit us, which many people could say was an advantage for Best Buy, was COVID-19. And the reason I use the word advantage, I obviously use it in a very respectful way. Obviously, COVID-19 has had a deleterious effect on so many people's lives. And we're just emerging out of that disaster after the past 60, 15 months. But there was an upswing, if you will, of need of all things digital, all things internet. Tell us a little bit about the impact that COVID-19 had on the Best Buy business model.
You said it too. I mean, similar to a lot of consumer electronic retailers, we found ourselves in that position where we had to, well, first of all, very quickly keep employees safe and customers safe. So I think that's another, reason why Best Buy, comes on top as a top employer. That was one of the first things our leadership echoed to us is, safety features. How do we do that right? And of course, the kind of business that we do was luckily needed around that time. Schooling from home was needed, working from home was needed, and we just happened to be, luckily positioned in that aspect. So we quickly had to understand how omnichannel is not going to bust its seams, in a lack of a better word. Now that we've taken all those inquiries through online, and as I said, leadership navigated and pivoted in such quick and seamless way. I mean, a lot of work was done. It just didn't seem like it to the outside world. For us to come up with, quick, projects like curbside pickup, which I hope a lot of Canadians have enjoyed, while keeping customers and employees safe. So those shifts were happening. There was a lot of water that was being threaded under the surface. For our technology team to get in there and really get the needs of operations implemented in a digital solution. So the way our organization has shifted and made changes to accommodate needs was unparalleled. I believe we got called out for it in numerous ways. But the one thing that stood out for me as a member of the organization was how each leader was being measured, one of the measurables became employee safety. And how often do you hear that? It's like, I'm really looking at you to do all your best by employees and your customers first. So having that as a key measurable, within it wasn't all about sell, like here's an opportunity, get things off the shelf, like get going. It wasn't about that. It became more about, again, the human way of going about and taking this overwhelming volume of need and being able to purposeful in that way. So you know us the way you know us. I would say just maximize everything our omni-channel by folds. Call center volumes were like busting. It was crazy times for everyone. But as I said, everybody came out with flying colors. Customers were happy. I think we're one of the retailers that actually answered the phone. A human being was at the other end of the line. And how often can you say that? And here we are. We're still a respected location, and we got the kids the laptops they needed to start schooling at home. We got ourselves people like us who need to go shift pretty quickly what they needed to get set up and going. And I'm happy that we were there for Canadians when they needed us the most.
As we start to transition out of this and we start to see the vaccination numbers increasing, we're hearing a lot of controversy, discussion, discourse on the whole work from home concept. Is it going to happen? Is it going to stay? Are we going back to the new, or is there a new normal? What is Best Buy's stance on this? And is that trajectory, this rapid acceleration of growth and people using technologies, is your company anticipating that continued exponential growth, or flattening, or decreasing over time? What is your thoughts on that whole work from home concept?
I don't think anybody's fully figured it out yet, to be honest. I think it's a flow everybody's living through and trying to make the right decisions for their employees and for their business. The one thing I would say is, luckily we in Best Buy were set up for success without knowing, obviously about the pandemic. Working away concept was already being tried on, I would say, to see if this is something that we can, meet some of our unique employees' needs wherever possible. Nobody knew about the virus when we started working on Teams, for example. So I feel, you know, and I feel like we were kind of set up for success right before it hit. So a lot of times, if people didn't even know how to launch the time, we were already having like whiteboarding sessions, and things were happening. So as far as productivity, I don't think we missed a beat in getting the productivity the company was looking for. And leaders had to shift very quickly in digital leadership. Like, how do I lead and keep my team engaged in a virtual world? And our HR team came right in as quarterbacks and said, "Okay, what do we need to upkeep the mental health? How do we keep everybody feel like it's part of a family, while not being present?" So we went through almost like 2 years or year and a half of learning, and I think now, just like many organizations, we're kind of putting the learnings in the middle of the table, kind of looking at it and trying to decide for our future and what is that going to look like. So I don't think anybody's got a golden answer at this point. I think the best thing right now is make sure that everybody's needs are met as much as possible, and the fact they have the option to come to work if they want to. Not everybody's living situation similar, right? Some people like are happy about working away. Some just cannot wait to get away from kids and come to the workspace. So I think the best thing right now is having options available. That's the best any organization can do at this point. And I think each one of us will get there, but I think the shell is still kind of soft for all
100%.
of us out there.
And
Yeah.
I think there's a lot of push, as you know, with the advent and the development of infrastructure and 5G and being able to, as we talked about, the great dispersion that's all around us as people are moving out of urban areas into less urban or rural areas. And so all of this is paints the picture, if you will, or rethinks the canvas of what the Canadian economy will look like. Where are people going to be working? What sorts of tools they're going to be needing to do that? And I think Best Buy is well positioned as being a community expert in those areas. So let's actually just think about that further and explore, double click on the COVID-19 impact. This obviously has put health at the hearts and minds of everybody around. Usually people that never talked about a product or a drug's mechanism of action was now reciting it on the local news, and everybody was the new medical doctor. So there was a lot of excitement and interest that was spurred because of COVID-19. Tell us a little bit around Best Buy's decision to make a pivot in the healthcare space when there was an open road, if you will, to the whole work from home potential of being something. So you guys have specifically chosen a particular route in healthcare as opposed to going down the road of being the service industry for the work from home. So tell us a little bit about the decision making that was made there.
For sure. I mean, that decision of getting into this new sector was made by our parent company, I would say, close to 5 years ago, in fact. So we know what we're good at. We know we're great at retail, we're good at implementation, upkeep of technology. So when our leader at the time, asked us to go look new opportunities, our parent company identified health to be one of the playgrounds we can do pretty good at. So I call it playground because everything should be fun in doing. So that decision was made way before the pandemic has hit. And from there it was just exploration and bringing new talent in. We needed people from belly of health to come in and tell us how things are done. As I said, they were great at technology. We're not good at health. I mean, that's so a lot of discovery started. We almost had to, some of us put us, ourselves through like school, not proper school, but like, oh my God, where do I start from here? Because this is the most sensitive environment you can apply technology in. This is no longer, here, Mr. Robinson, here's a tablet, go have at it. These are vulnerable folks in vulnerable spaces, trying to do very basic things or trying to be convinced to do the very basic thing on their own. So I think, one of the great things the organization have done, rather than just trying to learn on their own, they acquired experts to come and join the organization. So acquisition of Great Call, led by David, and it was one of the great decisions that the organization made to say, we're not good at it, but come join us and teach us how things are done. So I think that's another massive project in building, and it means different things for Canada when it comes to health. Payer models very different in US, needs are very different in US. In Canada, we are blessed with free healthcare system. um, and so for us in Canada, we looked at our parents company like, oh, that's so exciting, that's so great. What can we do? Like, can you kind of like throw us a bone across the border? But very quickly we had to wise up to say, let's learn Canada first. Let's understand where do we have a place here, and then of course we follow our parents company pretty pretty quick once the decisions are made. But knowing Canada was like the most important thing for our team to do very quickly. So and I can, identifying the gaps in Canada we can apply ourselves was something that we learned before, starting to learn before and COVID hit. And it was, for us, it was less about health. It was like, oh my God, I'm in prison in long-term care. How can I see my daughter? So then it became connection first, health second. So we had to shift pretty quickly. We had to switch hats. We're like, okay, I was just learning about her. Now you want to connect. Okay, well, take off the hat, put the connection hat back on, and then now teach older adults how to connect, or teach these facilities how to even set up their older adults for success. So we had to go through a bit of an identity crisis on our own. And then now, like, where things were a little bit settled, tablets were like taught out, people were trying to connect with their families. Now it's like, okay, let's talk about health again. Let's talk about how do you talk to your doctor, and how do you want to measure your blood pressure remotely, for example. So I said those conversations are just coming in right now. Where at the very beginning, the best thing everybody could have done is keep that generation alive, and then put something in their hand where they can dare see if their family, if they were in a different space than them. Um, so I think we're well positioned now to start the health conversations again. I know that was a long explanation, but that was
Yeah,
the
no,
journey
that's
we had
actually
to go
perfect.
through.
So in Canada, we've heard about all kinds of disparate situations. Some worked out really well. Every province, as you know, has a different way of managing it, and the vaccination rates and the acceptance rates, and the ICU rates and everything else. So it's a very interesting place because there isn't a big, although we have national healthcare, there's transfer payments that go to each province, and each province determines how they're going to administer healthcare. But the one thing I think that came out loud and clear was that there was an extremely vulnerable population in those individuals living in senior living, and so long-term care homes. I'm just curious, since Best Buy is kind of a ubiquitous name with many tools that can apply to multiple generations. In this healthcare predicament, although we knew that there was a lot of vulnerability at the aged homes, why did Best Buy decide to particularly target and niche senior living homes?
Um, so it was almost like the reverse, like how they reached out to us as opposed to us reaching out, it was when restrictions came into play, there was so much we couldn't do in person anymore, and so that secret sauce I was mentioning was kind of missing, which is like in person Geek Squad touch where we could have done a lot more. So we quickly had to pivot to digital, and the only way to implement a digital service is a more organized structure. And where does that happen is in a building where there are others in the building who can
Mm,
navigate some of that service. So it's
right.
pretty hard to reach out to 5,000 seniors in communities like click here, as opposed to working with a life enhancement coordinator in the buildings like, Mary, just click here for all your residents, and then they can start, seeing some of these services that we can provide. So we had no option but to work with healthcare entities or organizations in order to launch those programs digitally, because more than anyone, the seniors aren't set up for success in that space. So and the biggest gap we have identified when we started learning about health was the lack of digital literacy for that generation. I mean, we're so good at selling technology to tech enthusiasts, right? And then if you look at the trends of people who just willingly walk into our store and ask the question, starts tapering off around age of 55 and onwards, right? When real life happens, life hits you with real problems, and you think less and less about fun. I'm not generalizing everybody, but that's really what happens. Now I have a mom who had a experienced stroke. I got real problems. Like, I'm not thinking about upgrading my TV, but I really want to, like, I need to learn new trades to take care of her. Um, so for us to learn where people stop coming to us for digital technology solutions, and then learn about the fears and asking all the 5 whys. Why? Well, the biggest one was, I don't know what I'm doing. I have no idea how to even get started. This is another task you're putting on my shoulders. So providing digital literacy to residents was the only place to start. It's like, let me just teach you the ABC, like, and this is why, we had some success in the virtual space and senior living, because this coordination, this organization within the buildings that could have rolled some of those services out, and we got lucky.
Yeah, no, it sounds like a really, I love it. It was more, you ended up catering to a need that kind of showed up, which is sometimes outstanding. And then you kind of blossomed and kind of it grew from there. And it sounds also interesting that you amplified the impact by hitting institutions that could actually start with 1 or 2 people, and they could amplify the effort. So you could affect the lives of many people, which makes a lot of strategic sense. So what I did think was really interesting as well is whenever I've thought about Best Buy, and again, the concept of Best Buy Health might be a new term that a lot of people are just going to have to start getting used to, because you don't associate Best Buy with health. But with Best Buy Health, the question now comes down to is the pivot or the mindset that we have associated with Best Buy from tools or technologies into services. So we've always associated with the Geek Squad. That's always been a service that you've provided. But now there's this new service. Like you're talking about services associated, for example, with your Assured Living program. Can you tell us a little bit about what that program is and the kinds of services that are provided?
For sure. So the golden rule is always find the gap, apply yourself. So the 3 major gaps we identified through our study in Canada was one, and I'll get to Assured Living through the gap itself, is the declining ratio of caregivers to care recipients. So in Canada, we're having less babies. The immigrants are coming in are older. They're not the ones to be hitting college when they get here, and less of our kids are getting into nursing school. So what could have been 6-to-1 ratio of caregivers to care recipient about a year ago is declining really fast. In fact, we can look at 1.5-to-1 ratio by 2035. This is pretty scary, actually, how that bubble of aging group is growing. So there are not enough human bodies to go look after the ones that need to look after. So the how we applied ourselves was looking at a wellness monitoring solution where one can have an eye out on their loved one 24/7. So if things do go sideways, there's way for them to react in time. So and then hopefully reduce the burden of like driving there 3-5 times a day in order to provide care. So being in there in time was very important. And so we partnered in the back end with wonderful company called alarm.com in the back end, who had a wellness monitoring flavor added to their security system. And of course, data security mattered to us most. So they're the ones who actually did, proven themselves in that space. So together, we got together and then created Assured Living. This also started in Best Buy US in our parents' company, which we then Canadianized. And the idea is, creating a circle of care around that care recipient where multiple caregivers can have a view of what's going on different things, even if they want to, and be able to react in time. So that's what Assured Living is all about, is a handful of sensors and a panel as the brain of the house that machine learns over time what this person's baseline is, and any deviation translates into some sort of messaging that someone can react to. Um, and so that's what Assured Living is. And the other 2 gaps that we are kind of touched on slightly other services I can talk about. We have two more. One is called Digital Citizen, which is a digital literacy program and tech support for older adults. That took a lot of thinking because we really had to slow down our pace in the way we teach technology. And we asked for adoption. And the third one is called Expand Your Reach, which is really us having a look in the industry to understand all these green companies that are coming up that have really cool concepts when it comes to health technology, but they don't have the arms and the legs to stand up across Canada, to see how we can become their arms and legs across Canada and help them implement their technology across. So we're happy to vet, through this long list of newbies out there or smaller companies, the ones whose technology are proven to be successful, and it's a small ratio of them. We then partner with them and to implement, whichever space their business is designed for. And what I want to say is all three services that we provide still rides on Geek Squad. So what we do is we go through this hand-picked process of bringing the agents who are interested to work in this space. It takes a lot of patience to come into this realm and then be okay to, talk a different language. Because if you're a Geek Squad, you're expected to talk in however many more than a seconds and just be all savvy and in and out of home. This is a very different space. And then we have to put through extra training, vulnerability, sensitivity, empathy mapping for them to understand how to conduct themselves in those spaces. So everything I just described to you that's Best Buy Health, still in Canada rides on Geek Squad platform and uses Geek Squad agents to perform.
Yeah, no, it sounds really interesting. I love the way you've done it. So I'm actually just going to kind of draw this analogy because these days we've heard all kinds of things about different ways that companies do investments. We've heard of SPACs, we've heard of companies doing IPOs, we've heard of personal equity or angel investing. It sounds like Best Buy has almost kind of created an ecosystem where they almost have become a major investor, and so they're trialing multiple different technologies, seeing which one kind of wins and partnering, and then being the distribution house, if you will, of those technologies. Is that a sort of a safe analogy to describe what you are doing with to enable you to remain agnostic with the kinds of technologies that you're administering through your services?
I would say that's more of so acquisition as a whole is a strategy our parents company has taken on. So they are acquiring different companies in order to bring that skill set in, and therefore Canada will learn from it. In Canada, however, yes, we're fast followers. Yes, we have to make sure things are transferable to Canada. Until those wonderful solutions are transferable to Canada, we just chose to partner with the right partners in order to deliver in Canada. So there aren't so acquisition that you read about are made by our parents company, and the partnerships that you read about are made in Canada. And partnership for us are uh, could be a little different in Canada, where we quickly had to learn that direct voice to consumer wouldn't work in technology. In fact, we could freak them out. They're like, who's seeing my data? What you want to sell me, Best Buy, big box, so we refrained from that very quickly. In fact, this is why you wouldn't see any marketing content on us. So we had to go learn to talk through the folks who know how to talk, do this talk properly. So working with healthcare entities, partnering with them was super important. We don't know their language. We had to learn the language. We had to learn about the gaps they know are in the house so we can translate that into technology needs. So knowledge translation between a human need into technology has been something that we weren't good at. We're still learning how to do that. So we partner at a very rapid rate, and trying to understand who needs to be at this table to tell us what's that big gap between medical grade technology and consumer grade technology. And if that gap can be filled with humans, great. Healthcare is at it, good luck. And obviously but if they're not human bodies to be able to cover that, then there has to be a play for consumer electronic to come and play. And there are lots of great companies putting out products to fill that gap. So our job is knowledge translate, learn the human need, translate into technology, learn how to implement in those vulnerable spaces, and upkeep, which is the sustainability aspect of it, is pretty massive and I've forgotten a lot actually.
Yeah, I love it. It is a great strategy. So we've heard a lot, again, recently in Ontario, there's a whole movement towards training a whole bunch of personal support workers, PSWs, and paying for their education and getting more nurses out there. And it's just kind of blossoming and burgeoning across the country, because the idea or the guarantee is they want to increase or up level the amount of service that's being provided. You're talking about the caregiver time. They're trying to guarantee at least 4 hours per patient per day. But as you allude to, there is a burgeoning, baby boomer population. This is going to burst at the seams. And so Best Buy is positioning themselves strategically to be that care gap, if you will, using and leveraging smart technology with a variety of other kind of supports in there that's kind of one-to-many, so that you're not exhausting the one-on-one that you may not have as viable. So just leveraging, or just kind of double clicking on the technology partnerships for a minute, is there's all kinds of things out there. We hear all the time, just even with the general consumers, about wearables, sensors, ambient biometrics. We've heard of, the Alexas and the Nests and all these other things, where the house literally becomes a new point of care. And the car potentially becomes the new point of care. How does Best Buy, or what kinds of technologies are you looking at for helping everything from fall prevention to smoke detection to wall buttons in hospitals? What are you guys doing in that with the specific technologies that you're focusing on?
We're talking to everybody you can imagine. So you're right, lots is coming up and there's lots on our shelf. I think what's important in this very space is the risk of working with standalone technologies. So right now, I'll just give you an example. An average person comes in, I'm Sarah, 47, my mom's, close to 70. I need to take care of her. So I can walk in and based on my imagination skill set, get one or two or three items off the shelf and go home and YouTube the heck out of it, trying to, connect and then hopefully, do something beneficial for mom. The risk of doing that, and some of those could be like technology that's like no, credible brands, and the next one is, oh my God, I don't know what that is, but I'm going to buy it anyways because it looks good. The risk of doing that and getting creative on my own is the lack of creating an ecosystem. So I just walked home with 3 different platforms and I have 3 different apps. I need to work with 3 different companies if anything goes sideways. And then over time, I'm probably going to get exhausted and kind of potentially give up on managing all these 3 platforms. So the flavor we're trying to add is, as I said, like bring in the human needs and then try to recommend ecosystems at the end to say, this is the kind of platform you can introduce in the home. And it's not like, we're looking for super old people to come in and start adopting technology. In fact, we want people to start adopting that concept early on. Like my age, I like a more, helpful home. I like my home to do more for me. We work all our lives to have perfect homes or like repaired home, up-to-date homes, and why not make the home do some of the work for us eventually? And then as time progresses, the idea, or at least our unicorn, is we just go out there and add ornaments to this tree, if you call it an analogy, over time, as opposed to patchwork of like multiple brands and multiple platforms. And I'm not, the good news is the bigger brands, the bigger muscles are getting there. Like they're trying to understand, they're trying to dabble into this industry, to try to understand what the needs are. And we can all agree, and this is no offense to our wonderful partners, nobody designed technology with seniors in mind or disabled in mind. Like, the mainstream is like whoever's happy to come buy it and we're happy to sell it to them. Where our service becomes required is like, I have no idea what I'm talking about, the technology end, but I have a dad who's got dementia. What is in the market for me? And the most responsible thing I can do is first understand understand, what the needs of this home is. And then the next responsible to do is recommend ecosystem to them that can eventually grow, progress with this individual's progression. Let's say in this case to be cognitive health decline. So if I do a good job as a consumer electronic creating those life solutions that can grow and progress with the individual's frailty or disability or cognitive health decline, and that's a job well done over time. And of course, upkeep this ecosystem. Things can go sideways. Operating systems upgrade themselves without the individual knowing. Things go out of, turn old over time. Technologies turn. So showing up at those times where we can have an evergreen program, for these homes so they're always up to date. And we're not first in Canada. Scandinavian countries have figured this out. I don't want to make it sound like we're the first to the punch, but if we can do some of that properly for Canada, I think that's a job well done, which we're still in the process of creating. I don't
Yeah,
want
it
to make
sounds amazing. And so one of the things I think is really interesting in this equation, and I love how you're bringing this to the table, which is, Geek Squad comes in, they're taught, specific, proper procedure around showing empathy and relating at a caregiver level or a patient level or a digital, an aged digital citizen level, what have you. Understanding that and making the appropriate recommendations on a systems level. So as opposed to just these one-off, this sensor doesn't talk to this one. Tell us a little bit about, in that ecosystem, is the overarching plan to create some sort of interoperability? And if there is an interoperability level or layer, is this coming in the format of a Best Buy app where everything kind of meets and melds and then there's this one seamless dashboard? Or are you partnering with companies that have these dashboards that then feed into a patient portal and the patient can communicate to their physician? At what level of depth are you helping to manage interoperability and seamless communication between all the various stakeholders in the healthcare system?
Yeah, it's such a sexy topic to be able to integrate. And very early on, I guess the root interruption to our early party was, hang on a second, even health industry is trying to figure this out within the regions. Like I live in BC, if I go to a doctor in North Van, the doctor in Coquitlam have no idea what they just said to me. So I think, we had to like have a realistic picture painted for us. So we kind of stepped back from the Mardi Gras is like, okay, well, hang on, this is the reality. So electronic medical records, not our play right off the bat. We can transmit right off the bat, or it cannot be integrated at this point. So we had to kind of chisel or chip away from what could be realistic for us. And what we brought it down to was exactly what we were talking about, which is, can we just have a home that works? Every corner of it can talk to each other, and hopefully if this individual leaves, we can know, we can move on with that individual if in case they fall outside their home. So that's the best thing the reality of healthcare kind of pushed us in that corner to say, you go figure out what you want to do very well. And when you got really good at it, let's talk about who can transmit data to who can see what. And of course, there's a whole HIPAA, all these wonderful policies we have to learn about very quickly where we're not compromising, anybody's confidentiality or transmission of data. So I think lot needs to be learned in that space yet. I think if everybody does a good job taking their corner of the ring and just become golden at what they do, have really stellar proof of concept put out, partner with, circle of excellence such as AgeWell, who have qualified researchers who can come work with you. Like, we want academia come and look at our technology. We should be having them coming and talk about the efficacy of the solution, the ethics of the solution at the end, have their stars on a solution, and then go back and say, okay, you guys, we're ready. We think we got a helpful home, concept ready to go. And then invite, others to come in and tell us, okay, well, if you want your patient's sugar level, for example, let's talk about how our technology can transmit that to you safely, where it's meaningful to you, and hopefully will come gel well with everything else, their x-ray, the medical imaging, data, whatever the case may be, which I think pharma is doing an amazing job. Medical imaging is starting to do an amazing job in that space. So I think I know that was a long answer, but everybody does well in their corner. There's a time that everybody's going to show up and bring their part of the picnic, to the panel, and then have really good conversations. I think one of our earlier challenges right now, like the people we want to picnic with right away, are actually telco companies, because for any technology to work in any space, this is space needs to be connected. We can't do anything, within analog homes. There's nothing, that we can perform well. So I think those are the people we need to work with, partner with. We got wonderful partners in that space. So we just need to like really get down to the LG level of, okay, in order for this X to work, this needs to have a minimum, internet access or speed of Y. Can we make that happen? Because a lot of times our CD comes to scratch when it's down to, okay, well, we got this really cool solution, but it just won't operate well. Or in the buildings, the same. Like, we need a commercial standard when it comes to long-term care, when it comes to senior living, to say what's the minimum requirement for this building to be connected, and then we can get excited about what we can put in there. So I think, I mean, there's steps to be worked in that aspect, and we should all really get at what we're good at the end of the day, before we start talking about who else we can exchange the goods with to make it even better down the road. And of course, AI has
I
this.
love the long-term vision there, Sarah. I think it's brilliant. I think it makes total sense. And I completely agree. A lot of people are playing in their space. It starts with a conversation, and this is how we're all going to get better. But you're absolutely right. We have to get the infrastructure in place. And it's wonderful to hear that you've got those partnerships in conversation. We talked about a lot of the scalable components of what Best Buy Health is doing, and that's really around a lot of these transformational sensors, wearables, technologies, putting them in the right ecosystems, and then actually adding a service piece to this where that component of it remains serviceable or sustainable or scalable. But there's a whole other, oftentimes it's considered the non-scalable portion. And that's when you start to bring the human service into it.
Mm-hmm.
I know that there's some things that you started implementing at Best Buy Health around things like social work teams, urgent response agents. How are you looking at the scalability of virtual care when it comes to one-on-one or real people, the training, the requirements, the cost? What does that look like for Best Buy Health?
And that's exactly what our parents company is doubling down on right now. So, after acquiring all these wonderful companies that just came and joined our parents company, I think, once we integrate, what we have integrated their service into ours, now we're the ones asking ourselves those hard questions. And that's, those are all the excitements that are happening across the border. I feel like we're missing out the party, but I think that that's yet to come, into play in a more meaningful way across North America. And lots of great work has been done. I think, great call aspect of urgent response aspect of our, Best Buy US services, exactly what you described. It is, that urgent response that, comes to a call center where I can have a very human conversation with you. That's has a lot more information that a 911 agent would have. Things like where is the key placed? Where is the, lock key versus breaking down the door? Or, does this person have what level of diabetes? What should we be aware of before we're arriving? So those are the services that's already in place in US. And as I mentioned, the journey of Canadianizing those is the journey we're working on right now. And that human touch is absolutely what, you just described is what's needed here, is connecting the dot between an absolutely stellar health service that already exists in Canada, and connecting it to what technology can collect, and our, our customer profile can connect, that can help the health industry show up ready and do all the right things when they're available. And we're going to be fast followers the minute, Canada's ready for such services. Should Canada need such services? Because urgent response is a service that Canada does provide, just outside a retail entity today.
So it's a really interesting space, Sarah, and I appreciate the humbleness of constantly needing to learn and excavate and not feel like anybody's arrived, because it's a constantly shifting tectonic plate type of environment where things are always moving and always changing. So I think what's interesting to hear about the Best Buy Health model is that you're sort of in this interesting um, place of combining the technology part of it, which is the scalable piece with the service add-on, and then also potentially the service place where you're actually helping with remote health and you're doing things like great call rides and getting people moving around, and so there's a service piece with real humans.
Mm-hmm.
But what it also says to me is that you're kind of being a generalist there, but then
Mm-hmm.
you see that there's some specialists in each of those areas. So you're seeing about the consumer electronic companies like the Googles and the Amazons or other really particular like technology focused companies. And then you're looking at the really specific service-based companies who are
Mm-hmm.
coming in and trying to do these services. How is Best Buy's plan to kind of create this, like you're saying, the system that's going to compete against all of these? And are you finding the marketplace getting incredibly crowded?
Yes. I think right now I worry more about being effective in those spaces and less about being competitive out there. I think there are a lot of claims out there around what works, what doesn't. And one thing we did very quickly in Canada is we invested in a technology lab where things are brought in, and I have this wonderful team who's smarter than me. We just go through the vetting of technology and make sure, does it work? Does it do exactly what is expected to do? Just less the marketing jargon. And I want to say, like, I would say only 10% of the results were actually green when it came to like error rates, proper implementation, easy to use, and backed up technologies in the back end. And I don't always, by that I don't mean the system's faulty. I just mean the system's been designed without senior in mind a lot of times. So I think Google's doing an amazing job in reaching out, asking the questions. All these wonderful mega organizations who are dear partners of ours, are now starting to ask our questions because we're the ones in home. We're the ones who get, you get those questions like, what does work for my mom? It's not necessarily a Google representative in the home. It's actually Geek Squad getting that feedback. So our job, our responsibility is trying to understand that need, bring it in, and then tap our partners on the shoulders like, hey, wonderful watch, except my client can't see the digits. Like, what can we do together here, right? Or really hold our partners responsible and presenting something that works, not just from a technology execution perspective, but also financially. I mean, when we retire, we don't have a lot of disposable income, right? So, coming up with ways where we partner with funding organizations who kindly raise funds for these individuals and homes and communities, or we bring desirable price points into the market for these individuals, is something that we yet have to solve for. So I think step number one, which is we're in the midst of doing, is tons of interviews, tons of knowledge translation, tons of testing, tons of implementation and pilots with the healthcare entities out there. And then at the end, I would always see this as a fluid river. Things will continue to change as long as we have something to offer, options to offer to Canadians at any given time, which are the 3 service offerings I was mentioning to you earlier. And then be able to show what the next generation of that is. What does implementation mean in the home? How much is it going to cost? And what the upkeep of it is going to look like is going to be a fluid journey. And
Absolutely.
we just have to stay on top of it.
I love it. And it all kind of comes back to the original concept that the digital, the Geek Squad is almost like the PSW or the patient support worker. But instead of them actually servicing the technology, they're actually servicing the people that are in there. So
Yeah.
I do think it's a really brilliant model. It is agnostic. It's almost like we talk about that last mile that Amazon oftentimes, there you can do everything else in the background, but the people that are in the system, and that's what I think Geek Squad, so brilliant. And I can't wait to hear how all of this goes. I think this is a great way to end the discussion, Sarah. We're at the top of the hour. I just want to say, for anybody who's interested in connecting with Sara, Best Buy Health, pharmaceutical, small technology company, we'll be leaving her contact information in the show notes below. We encourage you to connect with them. I think they've got some great things in play. If you enjoy this conversation, we also encourage you to check out impetusdigital.com. This is precisely the kinds of things that we do with payers, allied healthcare providers, physicians, and patients, bringing technology companies together to work on policies, ideas, concepts, and to move these really provocative concepts and agenda items forward. So please get in touch with us. We'd love to hear from you as well. Thank you to all of you for taking the time to listen today. We would really appreciate if you could like and subscribe to our channel, and also would love if you could leave us a testimonial on our podcast channel. Thanks to all of you for your time. Sara, this was a fantastic conversation, and wishing everybody a wonderful day ahead.